We don't want to hear shit when you lose your Medicaid. We don't want to hear shit when you lose your SNAP. We don't want to hear shit from those states when FEMA doesn't show up for your tornadoes, hurricanes, and floods this year. We don't want to hear shit when you figure out that those tax breaks are not for you, but they're for the rich. We don't want to hear shit when you figure out that no tax on tips and overtime ain't even real. We don't want to hear shit when you figure out that he is increasing the debt ceiling by trillions of dollars, which is going to cost us a lot. Because we try to tell you. So you're excited about this bill passing? Just remember when all that shit happens to you to not open your fucking mouth.
Uh-oh, that's intense. Hi beautiful people, welcome back to my YouTube channel. Thank you for stopping by, supporting your girl on this channel. So all credit goes to the creators in these videos. And guys, in today's video,
it is agreed to. Yeah. Without objection, staff is authorized to make technical and conforming changes to the matters considered by the committee.
Boom. The House Energy and Commerce Committee voted 30 to 24 to cut Medicaid. Republicans, it was straight down party line. Republicans voted to cut Medicaid drastically for millions of Americans. Republicans say they are cutting out waste. They are lying. The committee was ordered by Trump and by MAGA Mike to cut almost $900 billion out of the budget. And the only way this committee could do that was to cut Medicaid, and now they have. There have been protests. Americans have shown their displeasure in doing this to give a tax cut to the wealthy, to billionaires, and they've done it anyway. This was a marathon hearing. They worked all night, and they finally voted today. And there were protests. People in wheelchairs stormed the committee room to show and shout, "Don't cut Medicaid. Don't cut Medicaid." The bill now goes to the full budget committee. We can still stop this. Keep watching. Don't give up.
Big beautiful bill, Medicaid cuts. I'm for it because I am an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. I'm good with.
So ma'am, I'm just going to start off by saying that as a physician, you are able-bodied and able to go to work 40 hours a week until you're not, right? We are all just one illness or accident away from being disabled. So this isn't really the strongest place to start your argument, but continue.
Not an immigrant that I can't prove my citizenship to get free benefits. I'm good with that.
So ma'am, I don't know if you missed the memo, but undocumented immigrants cannot receive federal Medicaid benefits because one of the documents required to apply for federal Medicaid benefits is a Social Security card. You need the Social Security number, and as their name would suggest, an undocumented immigrant lacks the documentation like a Social Security number to apply for and receive federal Medicaid benefits. So, continue.
All these changes for Medicaid, y'all talking about people going to be losing so much Medicaid. What about us? We go to work every day. We took our kids to daycare. My kids take her kids to daycare so that she can go to work. People need to stop just getting free benefits.
Well, since you only seem to care about yourself, let me as a physician explain to you how these Medicaid cuts are going to directly impact you and your loved ones, even though you don't receive federal Medicaid benefits. Now, just stick with me till the end because this is really important, okay? So the big beautiful bill is going to cut around $930 billion from Medicaid, which is going to kick anywhere between 12 and 17 million people off of their health insurance. And these are American citizens. The reason I highlight that is because, as I mentioned before, undocumented immigrants are not eligible for federal Medicaid benefits. And I know you don't care whether or not undocumented immigrants live or die because you don't view them as people. So I'm just going to move that aside for now. And I don't think a lot of people realize that Medicaid funds a lot of healthcare in this country. A lot of systems like hospitals, nursing homes, and healthcare clinics, especially in rural and underserved areas, are heavily reliant upon Medicaid funding. So Medicaid cuts, almost $1 trillion worth, are going to be really, really detrimental, disproportionately so, to those facilities in rural areas. And what happens then is those facilities close. They can't stay open without the funding. And what that does is it exacerbates, that means makes worse, the chronic disease burden in that area and the healthcare disparities that already exist in that area. So that means people get worse. Their chronic illnesses get worse. And now the hospital that was once 10 minutes away from them now is 35, 45 minutes away, which leads to delays in care. People can get sick and die. People can get sick and have to quit working and go on disability and unemployment. So unemployment spikes in these areas. And then that's going to also shift the burden to larger urban medical centers, which even though they have more resources, they're still finite resources. And a lot of these larger academic medical centers are already struggling with budget cuts from Trump's NIH funding cuts. So they are already short-staffed as it is. And one of the major resources in these institutions is the healthcare workers themselves, who are already burnt out and tired from having to work a whole ass pandemic. I know some of you guys forgot about that, but the healthcare workers haven't. So now you're taking an already stretched thin workforce that's burned out and having them do more and more with less and less, which is going to lead to substandard care. It's going to lead to longer wait times in the emergency room, longer wait times for specialists, longer wait times for things like elective surgeries, and it's going to put more burden on an already overburdened healthcare system. And just because you yanked healthcare away from 17 million people doesn't mean those 17 million people just stop getting sick. Sickness still happens, and they're going to have emergencies and require emergency care, require hospitalization, because EMTALA still exists for now. We have to provide that care to those people. And if they can't afford to pay for it, the hospital, isn't going to be able to just eat that cost. So what happens is they shift the burden of cost onto health insurance companies, meaning that they just increase the prices for things that private insurance pays for, and that means your private insurance premiums are going to skyrocket as a result. So you're going to have to pay more for the health care that you're already getting. And because of the stretched thin system, the health care is just going to be substandard. And heaven forbid you have a sick older family member at home who would need care at a skilled nursing facility, because a lot of those facilities are going to close, and the ones that don't are just going to be overburdened and overrun and not have any space. So you're either going to have to hire a private aide or a nurse out of your own pocket to take care of your elderly loved one, or you're going to have to just take time off of work or quit work to take care of them, which is going to cause more financial issues. So you can see that this has a pretty big ripple effect, and it doesn't affect the freeloaders getting free stuff or the undocumented immigrants who are just stealing from us. But hey, while everyone's getting sick and dying and struggling to make ends meet, at least you can rest assured that the big beautiful bill is going to make sure that the wealthiest people in this country get their tax cuts, because I personally am willing to sacrifice grandma if Jeff Bezos can get his fourth yacht.
I bet you didn't know that for some people to go on Medicaid, they have to give up their houses, all assets, clear their bank account except for $6,000. Surprise! That's how you end up in a long-term care facility when you run out of Medicare days. You go on Medicaid. Medicare actually doesn't pay for long-term care. You only get 90 days after each qualifying hospital stay. And having a qualifying stay is not as easy as you think it is. You just can't drop your mom off at the hospital and say that she's sick and boom, 90 days to long-term care or 90 days in a nursing facility. Oh, no. You have to actually be sick enough and meet criteria. And every year, criteria, according to the Centers for Medicaid and Medicare, get higher and higher and higher and higher and higher. And what happens after you have that qualifying stay and you need more care at the nursing home? Don't worry, you get 100 extra lifetime days. But once you lose those, there's no more days. So many people, if they're unlucky enough, and I used to be a case manager and a critical care nurse, so I have seen people from all income levels be affected by this rule. So these people give up all of their assets and their homes to prepay for their long-term care because the government promised if they gave up every single asset, they would be taken care of. So now it's kind of effed up to boot those people off of Medicaid, since they already, gave the government their home and their bank account. How do you avoid this? Case manager life hack. You put your parents and your own assets into a trust. And that's not even as easy as it used to be, because now they look back 5 years to ensure that while grandpa wasn't in the hospital, you didn't call a lawyer and protect all of his assets. So this very thing didn't happen. I own a startup now because this is the kind of day-to-day healthcare dystopian nightmare that we had all been living in for years, and it is getting worse, and this is a sign that it is getting worse. So call your senators, call your reps, tell your parents. People don't know this. Hide your assets. Not like hide them, but hide them in a legally viable way. Call your trust and will attorney person. So a lot of people don't know that. I don't know what the government, I mean, clearly Congress doesn't know this either, and they think they'll be safe too. Where are those people going to go? They are in long-term care and gave up everything because they could not care for themselves any longer, or their families could. That was already a problem. Losing everything to be cared for after you've worked hard your entire life is a problem. It disgusts me. Call.
You're seriously falling for this? Like, seriously? You are being manipulated into not caring that people are losing health insurance. MAGA was taking heat for Medicaid cuts, so they quickly pivoted, flipped the script, and said, no, we're not cutting Medicaid. We're just kicking those undeserving and lazy people off of Medicaid. Your lack of understanding about the U.S. immigration system and healthcare system is being exploited, and MAGA is trying to convince you that some people deserve healthcare while others do not. Immigrants without full lawful status are already not eligible for federal Medicaid, and the only reason some states have expanded their state health insurance programs to include these folks is because it's cheaper. It's cheaper to insure people than to not insure them. And these immigrants, regardless of their documentation status, are contributing to our communities. They are building our economy. They are paying taxes. There is no amount of creative math that can be done that only kicks undocumented people off of Medicaid and gets us to $800 billion worth of cuts. It's not possible. On the moral front, everyone deserves health care. On the financial front, bad health care will always be more expensive than good health care. And no one can make an economic argument that kicking people off of health insurance is going to save us money, because it won't. It is going to cost all of us way more money in the long run.
A lot of information going around about Trump's big beautiful bill, specifically in relation to Medicaid cuts. Democrats are trying to prevent Medicaid cuts. Republicans are either supportive of them or saying that there aren't any Medicaid cuts. There's also a lot of conversation going around about undocumented immigrants receiving Medicaid. So if you want to know what's going on, follow along, I'll explain. We're going to look at these two questions. Does this bill cut Medicaid funding, and do undocumented immigrants get Medicaid funding? So first, does this bill cut Medicaid funding? Yes, and I always show my work, so I'll explain why. First of all, it's called the Big Beautiful Bill because that's what Republicans named it. You can find it by searching Big Beautiful Bill full text. If you type full text at the end of things, that's always my tip for getting the actual document versus an article about it. So this is it, and this is what it looks like. Secondly, what is Medicaid? You've probably heard of Medicaid, but if you don't know what it is, it's insurance for people who are low income or with certain disabilities, elderly people, pregnant people, and more. The kind of partner program you always hear about with it is Medicare, which is health insurance for people 65 and older. And Republicans have long said they were not going to cut Medicare and Medicaid, but when their budget proposal came out in the spring, it was very clear that they were. Because in their budget proposal, they directed the Committee on Energy and Commerce to cut $880 billion from their budget. And the Committee on Energy and Commerce is the committee that oversees Medicare and Medicaid. And so you could say, okay, well, maybe they're going to cut parts of their budget that aren't Medicare and Medicaid, but that is impossible. The Committee on Energy and Commerce, outside of Medicare, Medicaid makes up 93% of their budget. And if you take away Medicare and Medicaid, they only have $581 billion left in their budget. So that means if they cut every single dollar of their budget that wasn't Medicare or Medicaid, they still would not be able to cut $880 billion. So it was clear that they had to cut Medicare and Medicaid. And now that the full budget's been released, it's passed in the House, it's being voted on in the Senate. Again, this is what it looks like. We can see how they plan to cut this $880 billion. It's through various programs, but the biggest one is work requirements. So it says that they're now going to require certain people receiving Medicare to meet community engagement requirements, including working 80 hours or completing 80 hours of community service, a work program, education. You can read more. There are exceptions for people with disabilities, pregnant people, and more. But what these work requirements often do is they remove people from Medicaid not because they shouldn't be on it, but because they can't keep up with the burden of the paperwork. And you might think to yourself, okay, well, I'm sorry, but if they're receiving federal benefits, they have to complete the required paperwork. But remember who this program is for. It's for people with low incomes, people with disabilities, and more. And so there are a lot of people in this group who paperwork is going to be a huge burden. They might have inconsistent housing, so they might not be receiving mail to the same address. They might have disabilities that aren't quite documented, so they still have to complete these requirements, but the disability gets in the way, and more. So at the end of the day, what this results in is people who need Medicaid losing it. And the Congressional Budget Office estimates that and other requirements they've included will result in 10.3 million fewer people being enrolled in Medicaid. So over 10 million people in America are going to lose health insurance because of these new cuts. And people like the Vice President are calling this minutia compared to what else the bill offers. But for the people who are going to be losing their health insurance and their families, I don't think they would consider it minutia. So now secondly, do undocumented immigrants get federal Medicaid money? No. No matter how many times Republican leaders tell you that undocumented immigrants are getting Medicaid coverage and they're coming to this country and just getting free health care, it is not true. And we know this because it's federal law. So Medicaid's core federal requirements, you can look right here at Medicaid.gov. We can see right here, to receive Medicaid, you must be a citizen or a certain qualified non-citizen. And if you search who qualified non-citizens are, it is this list. And this list does not include undocumented immigrants. But people's confusion on this comes from two places. Well, three really. First, Republicans just keep telling you it's happening when it's not. But the other confusion comes from two things: emergency care and state programs. So anyone who is in this country, whether you are visiting, whether you are a citizen, whether you are undocumented, if you have a life-threatening emergency and you go to the emergency room, they have to treat you and they have to save your life. That is a doctor's responsibility. So if you show up to the hospital and need emergency care, in some circumstances, the hospitals can then bill Medicaid for reimbursements for that care. But it's estimated that emergency Medicaid spending makes up less than 1% of all Medicaid spending in the country. In fact, it's 0.4% of total spending. So 99.6% of Medicaid spending in this country is not this emergency spending. Second is state spending. So some states like California do allow undocumented immigrants to enroll in Medicaid in the state, and it is funded entirely by state dollars. And states do receive Medicaid matches from the federal government. It's called the FMAP, or the Federal Medical Assistance Percentage. And what this is it's how much money the federal government gives you for every dollar you spend in Medicaid coverage. The federal minimum is 1-to-1. So for every dollar a state spends, the federal government gives them $1. California is at this minimum, so their rate is 50%. So California funds 50% of its Medicaid program, and the federal government funds 50% of its Medicaid program. Other states like Alabama, the federal government funds much more of their Medicaid program. They fund 72.58%. This was in 2021. These are the 2026 estimated rates for those same states. People are like, right, California is allowing undocumented immigrants to receive Medicaid funding, and then the federal government is matching that funding, so the federal government is paying for undocumented immigrants in California. No. Because these same Medicaid provisions must apply in order for California to receive a reimbursement for that Medicaid spending. So California is only receiving reimbursement for Medicaid spending on people who are citizens or qualified non-citizens. So instead, what Republicans are doing is they're telling you that they're removing undocumented immigrants from the program, 1.4 million of them. But if you look back in the bill, what they are doing is they are reducing that FMAP percentage, so this funding, for any state who provides health care to undocumented immigrants, regardless of the source of funding for such assistance. So no, undocumented immigrants do not get federal Medicaid money, and now Republicans are trying to penalize states for giving them any state Medicaid money, with the goal being that states would then lose funding and kick undocumented immigrants off their state-funded programs. And that is Medicaid funding in the big, beautiful bill in a nutshell.